Hi, I'm Veda. I'm a paramedic and I'm going to be taking care of you on the way to the hospital today, okay? Alright, we're about 15 to 20 minutes away from St. Mary's and we're going to get you there as quickly and safely as possible. Now, I know you said you were stung by a bee. Can you tell me a little bit about what's going on right now and how you're feeling? Okay, so that swelling and itchiness, is that just around where you were stung or does that seem to be spreading at all? Alright, so the itchiness is kind of spreading. Okay, can you tell me where you were stung? Just on the neck, nowhere else. Okay, just take a look at that. And are you having any trouble breathing at all? Okay, good. If you do start to feel any trouble breathing, you let me know right away, okay? I'm just gonna come in here and take a look at your neck. Yeah, I do see the site of the sting. Red and quite swollen. Actually, it looks like you have some hives popping up as well, so this does appear to be an allergic reaction. And the stinger is still in there. So first thing, I'm going to take the stinger out. I'm going to be very careful. We don't want to pinch it because then it will release more into your body. So I'm going to be very careful to remove the stinger. Just get in here. Okay. There we go. Just pull that out. Alright, got that. And I'm just going to wipe that down with alcohol pad. Good. Alright. And any trouble breathing at all? Okay. So with the hives present, I'm going to want to get you started on Benadryl quickly, but just let me listen to your lungs. Okay, you feel some swelling in the tongue? Alright. Okay, breathing has gotten a little bit more shallow and rapid, and with the swelling, it does seem like you're having an anaphylactic reaction. So I have an EpiPen here. This will release 0.3 milligrams of epinephrine into your system. I am going to inject this into your outer thigh muscle. It goes right through your pants so we don't have to take anything off. And it's going to feel just like a bit of a jab, okay? On the count of 3. 1, 2, 3. Alright. I'll just have to let that release in. Give that a moment. Okay. Very good. Alright. Yeah, I know that's definitely not the most comfortable, but where you're having trouble breathing now, we definitely want to get that in there. So that should help relieve some of those symptoms. It takes about 3 to 5 minutes to kick in. So just try to stay as calm as possible. You're doing a great job. I know the swelling can be kind of scary. I'm going to put this pulse oximeter on your finger, okay? Alright. Okay. We have 94% O2 saturation. So I am going to put an oxygen mask on you, okay? This is just oxygen. It's going to help you breathe a little bit. Okay. Here. And get this on you. Okay. There you go. Get that all settled on really nicely. Okay, still at 94% O2 saturation. I'm going to check your pulse now, alright? Rest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so right now your pulse is 110. That is a bit high, but that's normal as the epinephrine kicks in. It does make your heart go a bit fast. That combined with the reaction and the anxiety, it's normal. I know it's a bit uncomfortable. You're doing great. Alright, how's your breathing? Okay, it seems to have slowed a little bit. You're getting some better breaths. Okay. Alright, so I'm gonna go ahead and listen to your lungs again. Okay. Give me a nice deep breath if you can. Good, and another one here. breathing is a bit better now. I am going to get your blood pressure next. I'm going to come in here, get the cuff on your arm. Alright. Great. Get that nice and tight on there. I know that alone can be a little uncomfortable. So go in here and okay. Good. BP is 120/80, so you're okay there. Alright. So about how long ago, how long between when you were stung and when you called? Okay, so, alright, so just about 2 minutes. So your friend's a beekeeper, so they probably see a lot of reactions. Yeah, alright. Well, I'm really glad they recognized the beginnings of a reaction and called. Okay. So, at this point, you've never had a reaction to a bee sting before. When's the last time you were stung? Okay, so not since you were a kid. About 10 years old. Okay. Do you have any other allergies? Okay. And any known heart conditions? Alright. I asked just in case we need to give you a second dose of the epinephrine. Sometimes we do. You often have a rebound reaction, sometimes within about 15 to 20 minutes. So if you do start to feel any swelling or difficulty breathing again, let me know. When's the last time you ate or drank anything? Okay. Pretty recently, yeah. Alright. Yeah, the hives there. Difficulty breathing, swelling. Any pain? Okay, just where you were stung and yeah, where we did the EpiPen. I know that's pretty jarring. And that's it though, no pain anywhere else. Okay. Any other symptoms? No. Okay, good. Looking back at your neck, so that hasn't spread any further. I am just going to do a quick head-to-toe physical exam where you're wearing a t-shirt and shorts. Definitely see most of your skin here. A bit pale. Okay, just checking to make sure. Sometimes if we have a lot going on, you could get stung multiple times and not notice it. It's a little unlikely, but we'll just make sure. Alright. Okay there. Okay. Yeah, okay. So everything looks okay. I'm not seeing anything else on your skin that we should be worried about. Gonna keep that oxygen going, keep you breathing nice. O2 saturation is at 95%. Okay. Gonna listen to your lungs again, alright? Okay. Good. Nice and deep breath for me. Good. And other side. Very good. Other side. Good. Back to the side. Alright. So breathing sounds good. I'm gonna start an IV with some fluids for you, and we're also gonna push some Benadryl, okay? Let's see, IV here. And get that ready. Set up the bag over here. Alright, so this is just a saline solution, and it has a bit of Benadryl as well. Okay, just sanitize cafe is. Alright. And you're just gonna feel a pinch, okay? And it's in. Very good. Take that off. Alright. So we'll get those fluids going for you, get you a little bit of Benadryl to help with the reaction. How's your breathing? Okay, good. Yeah, and you're doing a great job. I know this can be really scary. Have you ever been in an ambulance before? Okay, well that's good then. Haven't had any bad health issues in your life, hopefully. Okay. So your friend's a beekeeper? Oh, that's really neat. Oh yeah, that's really nice. Do they sell the honey? Farmers markets. Yeah, I love farmers markets. That's really cool. Okay. What's the name of their business? Oh, that's cute. Oh, okay. Yeah. Alright, we're doing really well. O2 is still at 95%. I'm gonna get your blood pressure again, okay? That cuff all inflated. Alright. Okay. Great job. 120 over 80 still. So really good. Alright, let me just take a look at your neck. Okay. It's looking really good. Alright, you're doing a great job. So, do you live near here? Okay, yeah. Yeah. Have you been to St. Mary's before? Oh, okay. Well, again, that's really good. Sounds like you're a pretty healthy person. Yeah. It's too bad that you seem to be allergic to bees, though. I mean, I guess, maybe no more going over to the hive at your friend's place, or at least suiting up thoroughly if you have to. Okay. Yep, looking really good. Right now we are about 5 or so minutes out, okay? Alright. So when we get there, we're going to bring you inside. I'm going to take a look at you, make sure everything's okay. They are probably going to also prescribe you EpiPens in the future so that you can make sure you have one on you in case you ever get stung again. Hopefully it's not going to be a regular occurrence for you. I know probably most people who aren't gardening a lot or working with bees, they probably don't get stung too often. So in terms of having to be allergic to something, it's not the worst, I guess. How's the oxygen mask feel? Are you okay? Okay, good. Yeah. Alright. Just making sure everything is good. Yeah, I mean the weather's pretty bad, so okay, so they're all inside. Yeah. Oh, that's cool. So they have in their building up on the top floor. That's really neat, so it doesn't have to be all outside or anything. Yeah, this rain is pretty torrential, so get there as quickly as we can to the hospital. Alright, just check your IV bag here. Looking good. I'm going to listen to your lungs again, okay? Still no trouble breathing? Okay. You breathe in for me. Good, and out. Good. Other side, in and out. Great. O2 still at 95%. Okay. Everything looking good here. So I can't believe you haven't been stung since you were a little kid, though. I mean, I guess I haven't either. Really, when you were playing outside, you were probably much more susceptible to bee stings, you know? Yeah. And it's good you don't really have allergies to anything else, so That's lucky. Just the seasonal ones. Yeah. What do you take for your seasonal allergies? Yeah, I normally just take something over the counter like Zyrtec or something, but if that works for you, that's great. Actually, you know, they say local honey can help with seasonal allergies. I guess it's sort of like a pollen exposure type of thing because the bees use the pollen to make the honey, so maybe bees can help you with one of your other allergies, who knows? Okay, let me just look at your neck again. Alright. Okay, so I do notice that your breathing's gotten a little bit more shallow. Alright, it looks like we're having a rebound reaction. Now this is perfectly normal. It happens all the time. So I'm going to use another EpiPen, same thing. I'm going to go ahead and put this in your other thigh so we're not injecting right in the same spot, okay? So on the count of 3, you're going to feel this again. 1, 2, 3. Good. Alright. I know it's super uncomfortable. You're doing so well, okay? Just let that disperse. Get the epinephrine in there. Okay, administer 0.3 milligrams of epinephrine. Alright. It's actually, it's very common that we have to give 2 doses over this amount of time because you have the rebound reaction. And I know you're going to feel that heart rate going up a bit. Let me get your pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. Yep, we're at 115, so heart rate's gone up a little bit. Everything's going to be okay. You are in stable condition. Just try to keep breathing as calmly as possible. It's going to again become easier to breathe. You'll feel less swelling in the throat and tongue. Just a minute or so for that to get into your system and take effect, okay? O2 saturation is 94%, and I'm going to get your blood pressure again, alright? Still 120/80, so that's good. Alright. Good job. IV is good. Just gonna come in, take a look here. Yeah, we do see those hives there. Otherwise, skin looks good, just a little bit pale. Okay, your breathing has started to slow a little bit, that's good. O2 saturation is 95%. Okay, you're doing a great job. Alright, we're going to be approaching the hospital in about a minute, okay? Once we get there, we're going to get you right into the emergency room on this gurney. Alright, you don't have to get up, nothing. We'll roll you right in. The doctors are going to take really good care of you, okay? I'm going to keep the oxygen mask on you. Keep that with you as well as the IV drip, okay? Perfect. O2 is 95% saturation. Alright. Yeah, I know it's a scary experience, but you have been doing a fabulous job. Very brave. Yeah, I know that EpiPen isn't super fun. It's pretty painful, but unfortunately necessary, and that makes the heart race and stuff, so just want to make sure that you are okay in transport, and then at the hospital they'll take it from there. Okay, yep, we are pulling in, so I'm gonna go ahead and get everything all set to move you and get you right in there to the emergency room, okay? You have done an amazing job.